Hi everyone, I'm Arshiya Seth. I'm a primary care physician at Somerville Hospital Primary Care. I care for over 1,000 patients. Today, I want to tell you a story on how we transformed patient experience of care and work experience of our staff. One day, 2 years ago, I went to our online patient survey system and I saw that within a day, our clinic had received an outstanding review and a poor review from our patients. Like Yelp for restaurants, TripAdvisor for hotels, Press Caney survey system gives our patients a platform to rate the care they receive at clinics and hospitals in areas such as wait times, professionalism, communication skills, and lots more. Both the reviews were related to wait times. In the outstanding review, patient said, "I waited for over an hour to see the doctor, but it was worth it. I was told he was running late, so I got a coffee. Everyone is so nice and really treats you as if you matter." In the poor review, patient said, "I waited for 30 minutes and had to constantly ask the front desk when I would be seen. No one could give me an answer. No one here cares, and so I left." Reading those reviews left me confused and disappointed as to how different the two patient experiences were. So I went ahead and asked my family and friends, "What do you like about your doctor or the clinic where you go?" No one remembered a test result, a diagnosis, or a conversation, but they all remembered a feeling. They remembered being scared, anxious, or in pain. My husband remembered a joke that his doctor told him. Some patients remembered that the clinic felt they were taking care of them. Patient experience scores have become an important gauge of quality. They've shown to improve patient compliance, health outcomes. They've shown to reduce hospital admission rates, malpractice costs. They've also shown to improve job satisfaction. And so our journey began. Our multidisciplinary team with 3 students and a patient partner started out with the information gathering phase. This had 3 parts. First, walking in the patient's footsteps. We wanted everyone in the clinic to walk in the patient's footsteps and observe and get feedback from the patient's point of view. We wanted them to tell us what could be done differently. Our staff came up with a long list of things, and they were very common and easy things. Our staff wanted to welcome patients. They wanted to inform them. They wanted to keep patients aware of the delays and the wait times. Second, we shared powerful patient stories and comments with staff during full staff meetings. And third, we shadowed our staff. Our 3 students shadowed our staff in person and in phone as they went about their day. We observed behaviors such as welcoming, informing, showing empathy, etc. We recognize that each patient comes in contact with a member of staff at least 20 times during an encounter. This gives us 20 opportunities to wow our patients. From the data we gathered, we recognized 3 important things that needed our most urgent attention. First, informing patients about delays. Second, our sensitivity to patients' needs. And third, courtesy of registration staff. To address this, we conducted workshops, a total of 14 workshops over a period of 3 months, where our staff learned to do service recovery when things go wrong. They learned how to manage up their colleagues and coworkers. They learned to use ADIT from the STUDA group, which is acknowledge, introduce, duration, explain, and thank you. Our staff also learned how to use keywords at key times, such as "thank you for coming in today" or "thank you for waiting for me today." We also learned how to reduce anxiety in patients when they come to visit us. One of the most powerful experiences for our staff was stepping into patients' shoes and doing role plays, acting as a family member during these role plays. As we went along our journey of improving patient experience of care, we recognized that if we did not address the happiness of our staff, our work would not be as meaningful. Happy employees make happy patients. And so we started our journey of improving staff experience of care. We conducted workshops on team building, on self-compassion, on recognizing anxiety in each other and improving work together, on mindfulness, and overall improving the joy at work. We wanted to improve our staff satisfaction by 50%, and we focused on this question in our survey. When I do good work, someone in this practice notices that I did it. We now use our internal website, CHA Cares, to address and acknowledge and recognize the staff that goes above and beyond helping patients. As we went along our journey, we had positive experiences and positive outcomes. We have shown improvement in all areas, from information about delays, courtesy of registration staff, sensitivity to patients' needs, likelihood to recommend, and our overall scores have all improved. Our workshops on improving patient experience and staff experience have led to a culture change, not only at our clinic, but also at Cambridge Health Alliance as a whole. From these workshops came out beautiful stories of why we chose healthcare and how our staff goes above and beyond. I want to share one such story with you. This is Maggie, my medical assistant. I recently saw a complicated patient from Bangladesh, new to this country and new to our healthcare system. She came with her son to visit me. After our appointment, I asked Maggie to help the patient do the blood draw, do the checkout. A few minutes later, Maggie comes and tells me, Dr. Seth, this patient is afraid of needles, so I'm just going to do the blood draw in their room. Oh, and I also gave her a juice box to drink. And you wanted appointments with cardiology, orthopedics, and a mammogram? I booked them all in the same day, so her son doesn't have to take time off from work again and again. Oh, and I also called the radiology techs to see if they could do the ultrasound right now, and they said, yeah, send the patient right over. I called the hospital shuttle, and they are picking her up. And just like that, Maggie wowed the patient, the family, and she wowed me, and she went about her day. She felt empowered and proud of the work she did, and she had a fulfilling interaction with the family and the patient. Everyone walked away from that episode feeling better. Not every patient encounter can be like this. We recognize that there are areas that need improvement, but we have the opportunity to rise to the occasion with every patient that we meet. We still need to work on areas such as accountability, sustainability, preventing burnout in our staff like Maggie. And we will continue to do that. In the upcoming years, our goal is to spread these workshops, take them to another primary care location within Cambridge Health Alliance, and to keep the momentum going at our site. What we have learned is that change is hard. But if you have engaged leadership, physician engagement, staff engagement, if you partner with your patients and do process improvement, you can make a significant improvement in patient experience and staff experience of care. You can improve joy at work and joy in our patients' experience. Thank you.